We're going to talk about an interesting topic that I think a lot of our patients for fertility concerns asks about, and that is deciding on vasectomy reversal versus a sperm extraction in a patient who a male partner has had a vasectomy in the past.
This is the Man Up Podcast, the doctor's guide to men's health. Each week on our podcast, we interview top specialists on the field of various topics in men's health, and you have questions that you're too afraid to ask, and we have the answers. This week's episode is titled, Having Children After a Vasectomy. I'm Justin Dubin, and I am not joined by my co-host, Kevin Chu. Kevin Chu is on a flight back to LA while I am recording this in an airport in Chicago. We were both in Raleigh for this exam, and it was a crazy week, so we couldn't record together, and my flights got canceled, so I had to go from Raleigh to Chicago, now hopefully get to Miami. But I did spend the night in Raleigh during the March Madness, which was awesome. I was at an NC State bar when they won that game in overtime against Oakland. It was absolutely electric. Yeah, we're all over the place. It's been a crazy week, but we got a lot of fun stuff we're working on coming up. But this episode we recorded in person, another in-person one, and really what we're going to be discussing is having children after a vasectomy. Now, you can have children after a vasectomy, but there's different ways to go about it. The main two things we can do is a sperm extraction or a vasectomy reversal. And there's a lot of factors going into deciding what those things are, why you want to do a reversal or why you want to do a sperm extraction. Some of those factors include partner age, female partner's age, desire for how many kids, how long ago the vasectomy was, any other medical health issues that the male patient may have, any potential issues with pregnancy that the female partner may have, the time frame for which you guys want to have a kid. So there's a lot of factors involved, and Kevin and I are specialists in both the reversals and micro-TESEs, not micro-TESEs, sperm extractions, which are usually MESAs, PESAs, or TESEs. So I think this is a great episode for a lot of people out there, and about 5% of people annually are interested in either reversing their vasectomy or having additional kids, whether it's they are divorced and they find a new partner, or they decide they want more children in the long run. And I think one of the key things I do want to emphasize before we talk about this episode, which I don't know if we mentioned in the episode, is we do a lot of vasectomies. We've talked a lot about vasectomies on this podcast, and we'll continue talking about vasectomies. They're excellent. But, once in a while, I do have a patient who thinks about, maybe in the future, just in case they want to have a kid, but they're 100% sure they don't want kids. But, just in case. So what do? I offer sperm banking. And, that's something that you can always do before getting a vasectomy, and then you don't have this problem. You can always talk about going through IVF with the sperm that you have banked. And remember, all banked sperm really is to be used for IVF. But once again, you should be doing a vasectomy only if you're 100% sure you do not want kids anymore. But I think this is going to be a great episode for people interested, or couples interested in having kids after the male partner had a vasectomy, on deciding what they should do, whether they should get a reversal or they should get a sperm extraction. But yeah, it's been a long week. I am very tired. I'm in Chicago for like 3 hours. I wish I could leave the airport, but as you can see, I am literally in O'Hare, and Kevin's in the air. So we're going to get this episode to you either way, and enjoy this episode, and we'll talk to you guys shortly. Bye.
As men's health specialists, we know guys are shaving their balls. Yeah, we examine a lot of you, so we literally see it, but we also have the data showing it too.
That's right. According to research, over 85% of men trim their pubes. Not only that, but research shows that over 70% of women prefer a partner with at least partially trimmed pubic hair.
So guys, We know you're trimming the hedges, and we know that most women prefer you manscape. So if you're going to shave your balls, why not use the best men's grooming kit around? We're talking about Manscaped.
With the Manscaped Performance Package 4.0, you get the Lawnmower 4.0 with their all-new skin-safe electric trimmer that protects your balls from getting those cuts we've all had in the past. You also get the Weed Whacker 2.0 for trimming your nose and ear hairs. And let me tell you guys, we all need to do a better job of this.
Yep, that's right. Kevin and I both have the performance package, and we really love it. Manscaping has never been easier for us. And for our listeners, we have a special promotion. Go to manscaped.com and enter promo code MANUP and get 20% off your first purchase.
Go get your Manscaped products today. Your balls and your partner will thank you.
All right, so this is going to be a one-on-one episode. Just
One-on-one.
One-on-one. We're going to talk about an interesting topic that I think a lot of our patients for fertility concerns asks about. And that is the topic of deciding on vasectomy reversal versus a sperm extraction in a patient who the male partner has had a vasectomy in the past.
That's correct. And it's I think this will be an interesting conversation because there are benefits to both sides. So just to kind of sum it up, so after a vasectomy, right, your sperm has been obstructed. You're still producing it for the most part for most patients,
Right.
And as a result, you can't get the sperm out in your ejaculate, which is a good thing. That's what we want in a vasectomy.
That was the goal.
Yeah, that was
Right.
the goal. And so let's say circumstances changes. Maybe you and your partner or you and another partner want to conceive a child. So now you do have options, right? You have an option of one, vasectomy reversal, which is basically connecting both tubes together.
Reconstructive surgery.
Reconstructive surgery, usually done by specialists, two of which are sitting right here in front of you. And, allowing for sperm to come back out in the natural ejaculate. Or you could do a procedure to go in and retrieve sperm without the connections. So why don't we start, Justin? I'll let you start off. All right. Let's talk about sperm retrieval.
Well, I think I want to go even before that.
Okay. Before that.
Yeah, because I think that a lot of the decision making for a lot of this thing, more than anything, often goes with the history and talking to the patient.
I love it. Okay.
And there's several factors when I'm discussing, and we'll go into the procedures, but when I'm talking about factors and understanding what the best choice is, there's things I want to know.
Okay.
I want to know,
What do you want to know, Justin?
For men, I want to know, have they conceived in the past? Because not everyone who has a vasectomy has kids, of course.
That's true.
Two, I want to know, what medications they've been on. Obviously, we talk a lot about testosterone. A
Ad
lot of
nauseam.
guys I've seen have been on testosterone in the past. And then, medical history, surgical history. And then, how many kids do they want? What's the age of their partner?
Those are all really good, important things
These
to
are
find
all
out.
important things. And I often get some blood work, right? Now, what labs are you usually getting for these guys when they're coming in?
Mainly, the most important one that I get is FSH. All right, it's a follicle stimulating hormone. This is really a signal for us male reproductive specialists in if you're making good sperm.
Right.
I also check testosterone level. You check the testosterone level.
Yeah. That's pretty much the two that are important.
Yes. And no, I think you made a really good point because those things, such as how many kids you want, have you conceived in the past, what kind of medications are you on, what kind of medications do you want to stay on, will definitely play out and impact what choice you decide.
Yeah. And like you said before, some people have had kids in the past. They're going through a second marriage, or they just never achieved the goal that they wanted. I think the data says that about 5% of people men who have had a vasectomy in the past are interested in conceiving again at some point down the line, or interested in a reversal or something. Now, obviously, the female age is a big factor, and we'll get into that. But in general, let me talk about the sperm retrieval. So what is a sperm retrieval? So there's different kinds, but typically, if you are a patient who has had a vasectomy, what we'll do is there's two things really that some people offer. You offer a PESA or a MESA. Now, I traditionally I do a MESA.
I do a MESA too.
Okay, but there are people in the community I know that, and there's a lot of people that do PESA, which is percutaneous.
Exactly. That's what I was going to explain.
Yeah, go ahead.
So for a PESA, you explain the MESA. So PESA is basically taking a needle and basically identifying the epididymis, kind of blind in many ways.
Yeah, I mean, you're palpating it.
You're palpating it.
You're palpating it. You're feeling it. You know, we know what an epididymis feels like more than most people. And the epididymis is where, the sperm is stored. It doesn't just disappear. Where you're still making it. It just can't really leave the epididymis because you have the vasectomy.
And it's the reason why we're targeting the epididymis as well is because this is sperm that is most mature in the whole overall scheme of things. If you go into the testicle, that testicle, while it's good sperm, it is not necessarily the most mature. So when we talk about getting the best sperm, it's in the epididymis. So a PESA is basically just sticking a needle into the epididymis and then aspirating that fluid and utilizing that.
Yeah, and you can get sperm that way. Now, the amount of sperm and everything like that is up for debate. The MESA is a microscopic epididymal sperm aspiration.
That's right.
Where basically we'll take you to the OR. Some people can do this under sedation, I think. I usually go to the OR. I put you...
Same here.
And we use a microscope. We deliver your testicle out of your scrotum, make a very small incision, and then, we poke a little hole in it, and then we're aspirating all of that sperm that is in your epididymis into a little tubule, and then we send it off just in the same way as a PESA does. Now, the recovery process is different for everyone. Obviously, it's a pretty minimally invasive. I mean, it's not bad.
Yeah, it's not bad. And it can be debatable, but in my opinion, when you're doing it under a microscope, you can really evaluate the epididymis, see the areas that are best, more dilated.
Yeah.
To really get, you're already, the idea of doing a MESA is that you're going to end up doing IVF, right?
Right.
And so it's, for a lot of patients, if they don't have the benefits that are covering it, this is an expensive procedure. So if you're doing an expensive procedure, you want to put your best foot forward. That's kind of that's the way I look at it.
I agree. Listen, if you're going to do it, you want to do it once. This is pretty much what you're saying. And I think that's the big thing that you have to understand when you're deciding about a sperm retrieval versus a reversal, right? And that's something we didn't talk about is cost, convenience, and time. When we're talking about a reversal, often you're not allowed to have sex for a couple weeks.
Right.
There's no guarantee. It's 60 to 90% success rate in reversals, but very high success rate. I would not say.
Right.
That is a cheaper means at the end of the day, right? Because you're providing yourself with the opportunity to conceive naturally once you reconstruct the vas deferens. And then when you're talking about MESA, like you said, or a PESA or any sperm retrieval technique, you're using sperm which has to be used for IVF.
That's right.
And IVF itself has other costs, around the state, different states, different insurance situations. But in general, a lot of the stuff is not covered by insurance. It's an out-of-pocket expense. And then the partner, obviously, is undergoing a lot more stuff. It's potentially more invasive.
Look, the thing I always do with the couple that's in front of me when I discuss, options, a lot of the things that you mentioned before is the stuff that the couple has to consider, right? If finances are a little bit more, a little more tight, and if your benefits don't cover IVF, but your partner has a vasectomy, then a vas reversal in the overall scheme of things, like you said, is cheaper. But I stress what Justin said in that while the success rates are 90%, the one interesting thing I will say, and I think we should talk about it, is post-vasectomy, right, or post-vas reversal, are your sperm numbers back up to normal what it was before?
Most of the time it's not. You're happy to get sperm. Like, you're looking for sperm in your ejaculate.
Exactly. And I always tell that as a metric to my patients post-vas reversal. Like, hey, look, if we're getting 3 million per cc, 4 million per cc, that's awesome, right? As a starting point. And hopefully it kind of keeps building up. But, that's kind of where it's a little bit gray. And that's where a lot of studies have done where they try to say, like, what level are we at afterwards? But that can be stressful for you as a patient that's undergone a vas reversal afterwards. Right?
So it's really an excellent point, and I think that that's also where the age comes in, right? Now,
yes.
now it's not, we talk a lot about, couple fertility, and we talk about, the things that you need to, there's a male component, there's a female component, but at the end of the day, we know after the age of 35, fertility does decline in women. And, when you're talking about age, the one thing you don't have is time. And reversals take time. It can take sometimes up to a year to get sperm in your ejaculate, and there's a lot of reassurance. And if your partner is 35 years older or, plus, sometimes the reversal is maybe not the best option. I'm not saying it's a bad option, but it is definitely something to consider.
Again, nuance, because so many other variables involved.
Correct.
Right? Cost, situation, all that stuff. But, I go back to the episode that we had with Dr. Crawford, right?
Right.
She starts talking about for women, right, 35, 36, your percentage starts decreasing. And it doesn't mean hey, I'll just try naturally, and then at 40 years old, I'll use the magics of IVF to achieve the same success rates that you're getting at 35. It's not. You're getting the maximum success rates for that age 40. So you're absolutely correct. Later, if your partner is late 30s, even mid 30s, I would heavily discuss hey, what's the timing? How much do you guys want this? Because if you want your best optimal chances, going the IVF route, which is undergoing some sperm retrieval, seems like the more logical thing to do.
No, I totally agree. And the other thing is, how many kids do you want, right? A lot of these guys are in older age and, hey, I just really would like to have one child with my new partner, right? And then often, I think most of the time in these situations, the partner is there and you're able to have a conversation with, your patient and the partner.
Right.
And I think that's very important for guys listening who are interested in, having a child after vasectomies. Bring your partner to that conversation.
That's an excellent point. I can't tell you, guys, love you. We're all guys here, but I can't tell you how many conversations I've had with just a guy in the room, and they're like, that makes so much sense. But I always get the call a little later on from the partner who's like, hey, he just came back and doesn't remember anything. But it's important, to come together, because it is a decision that you're going to make together.
Yeah, and especially if you're doing a sperm retrieval and the partner is undergoing IVF, right? They're the ones who's really going to, you're doing your part, you're getting surgery, but that one little surgery is a lot different than undergoing a cycle of IVF and injections and things like that. So, I think, number of kids is a factor for a lot of people. If you have a 24-year-old, a 28-year-old female partner and you guys want to have 2 kids, reversal is probably something, you have time.
From a financial background.
For a financial point, right? And you have a little bit of time. And one thing I do often offer and for reversals when I do them is sometimes banking at the same time.
Same.
What are your thoughts?
I absolutely do. I counsel the patient, how much it's going to cost, and it's really saving yourself from a procedure. Let's say the vasectomy reversal doesn't work. Again, you have the statistics for success rates, how far out you are from the initial vasectomy. And if you bank the sperm, at least you have that as a backup. You don't have to undergo a MESA or a PESA or a TESA.
Right. We're already in there. We're looking at the testicle.
So it's the most optimal sperm because it's coming from the end of that vas that's been cut. So, I highly encourage my patients to do it.
Yeah. Now, here's a question for you. We talked about, so a lot of this in decision making, as we can see, is finding the right shoe for the right patient.
Yeah.
It's a lot of conversations. There's a lot of different factors: financial, age, medical history, desire for kids. There's a lot of different factors here. Now, what about the guy who comes in? He's had a vasectomy. You got the FSH. You got the FSH and the testosterone. The testosterone is normal, but the FSH is really, really high.
So how do I counsel the patient?
Yeah, and can you explain to our listeners what your concerns are there and how you counsel the patient?
Yeah. So again, well, let's talk about FSH.
Yeah.
FSH, follicle stimulating hormone. Really, it's I guess you could say biomarker, if you want to use some layman's term, to kind of give us a signal of how well your sperm production is,
Right.
how well spermatogenesis is going on. Well, first off, just because you're in your like mid-30s, mid-40s, you're like, hey, from everything that I hear, guys just keep making sperm all the time. That's not the case, right? Justin and I take care of guys who have impaired sperm production at early ages.
Yeah.
And so the FSH is kind of one of our markers. The higher it goes, generally we want it between like 2 to 7, but once it starts kind of going past that, if it goes up to 11, 12, you're starting to see that your testicle was stressed. It's trying to, the way it works is when you make sperm, it sends a signal back up to the head like, hey, stop producing that FSH hormone, like shut it down. We're good down here.
Right.
We're awesome. But if you're not making sperm down there, there's no signal going back. And as a result, that FSH keeps going up. It's like, hey, we're not getting that call back to say like, hey, stop producing this stuff. And so when that happens, first up, I go like, hey, look, if we're going to do a vasectomy reversal, I'm a bit concerned because it doesn't matter how well we connect these things. If you're not making sperm to get it out, we're doing this whole thing and,
Right.
It's
Not really valuable.
not really valuable. So, at that point, you start talking about patients with decreased sperm production, and that kind of really changes it. So I start definitely going the other way.
Right. That's exactly, yeah. So, anytime there's a question of whether, production is a problem, vasectomy reversal is probably not the option.
That's correct.
And you lean from a MESA that you also include the conversation of like a TESE or a micro TESE, just as a backup, right? Because if you have low production, sometimes the sperm never make it to the epididymis or the volume's there's just a small amount.
Right.
And you want to give yourself and your patient and the couple the best chance to have that child. So you would have to potentially open up the testicle and get tissue there.
You're absolutely correct. I do want to bring up, I think this is a bit of a controversial topic, but I think we should talk about it. A patient recently came up to me and he's undergoing IVF with his partner.
Mm-hmm.
All right. He actually, history of testosterone therapy, and I put him on a rescue protocol, got his sperm back. But one of the main things he was actually most concerned about going through the IVF process was talking about just implications from a long-standing standpoint, like for the child, like, increased chances of autism, all that stuff. I bring this up because this is a question that I get a lot, right? Does IVF, is the child going to have an increased chance for for other health issues?
Birth defects, things like that.
Right. So this is one of the answers I kind of give because I have a child, IVF, and I have a child that's natural. The technology out there, we're doing the best that we can, right? I say we, it's not really even us. We do the sperm side, but from the female side. Right. And doing the best that we can to try to prevent all that stuff or to choose the best sperm, choose the best egg, and to use it. But sometimes that's all, like we're maximizing the chances that we have. Why am I bringing this up? Because in a VAS reversal, the patient asked was like, hey, if I do a VAS reversal, theoretically I'm using natural ejaculate. And could I use that natural ejaculate for a future IVF procedure?
Of course.
Of course, right? If you want to think about it, that VAS reversal sperm is ejaculated sperm, which if I was to ask you ejaculated sperm versus sperm retrieval sperm, which
I think everyone wants ejaculated sperm.
Right. Because it's, again, what I'm trying to explain to listeners is that sperm that's matured all the way down the track, right? It's survival of the
I've
fittest.
not thought about this at all. This is interesting.
Yeah. I thought about it a lot just because I had a child that went through IVF and just, a lot of the debate and, discussion, like, do we want to do like ICSI, do IVF? Again, just a very segue from what we're talking about, but it's a very important thing for you to kind of consider, right?
I don't know if there's any data though supporting either way.
What do you mean?
Like, I understand, like, you always prefer ejaculated sperm for the exact reasons that you said, but you're like, no, I don't think there's increased risk of autism or anything through IVF.
It depends on what data you look at.
Really? So I don't know the
but
data.
But it's very, very small. Yeah. One of the things is in a recent JAMA article, they looked at 10 years out for kids in IVF, and there was you're talking small numbers here. This is like for the most part, it's not going to happen, but there was slight increased chance of hypertension in those kids.
Interesting.
Yeah. So still a lot that we learned, and we go to reproductive conferences. This is still stuff that's a lot of debate, but at the end of the day, if you're suffering from infertility, IVF has just opened up the gateway.
It's a miracle.
And allowed you to, conceive a child when something was, barring your way. So a little bit of a segue, but
no, that was interesting because I just learned something myself. So that's pretty cool. I think really the other things, that you have to really consider or have been discussed by us. I don't know. Is there anything else that we should be talking about at this part? I mean, just to kind of summarize, patient history, patient desire, couple desire, desire for kids, financial constrictions, how many, your sperm quality, the concerns of sperm quality, history of, previous kids, all play a role in a sperm retrieval or versus a vasectomy reversal. And, listen, just because your partner's 40 years old doesn't mean that, listen, you hear one of those things like once in a while, someone did a reversal and their 40-year-old partner got pregnant. I'm not saying it's like, and if that's your option, then that's your option, right? And we also understand that some people may only have one of these options available, but oftentimes there is a discussion to be had, and I think that it's important you and your partner sit down with a male reproductive endocrinologist, a male reproductive urologist, as well as a REI, and have those conversations.
Justin really nailed it there at the end. There are a lot of non-male reproductive urologists. I don't even know if they're necessarily urologists who do offer vasectomy reversals.
It's a great point.
And I just stress to our listeners, you want to sit in front of an REI. REIs, they understand, they're one of the main components of this whole process, right. And a male reproductive urologist. Because I'll tell you, probably these non-urology vasectomy reversal docs just want to do that procedure. They don't care about your intentions. They say, hey,
this is what I offer. This is the price. Take it or leave it.
Right. Exactly. So
because they just don't monitor. They don't manage men's health.
They're not they're not looking at it from a big picture, right? When we look at it, when we sit across from you, and same with the REI, how do we get you to where your goal is at? Right?
Absolutely. Yeah, I think that's about it. That's a great way to summarize this episode. So thanks everyone for listening to the in-person episode.
Hope you liked it.